This lecture is entitled Critical Evaluation of the Research Literature for the course GC 631 for summer 2020. A little bit about me is that in general, I'm kind of a skeptic, and I always have been. And when I became a scientist and I started reading the medical research literature, we want to feel confident that the conclusions that come from medical research are trustworthy conclusions. And sometimes they are. Most of the time they are, but not all of the time. And some conclusions are more trustworthy than others. And we have to learn to apply some critical thinking skills to the conclusions that we read. And they're not normal critical thinking skills. It's a different set of skills that you can apply to the medical literature to decide what conclusions you're going to have confidence in and which ones you might not. This cartoon is funny. I've always thought this cartoon is funny. It's very, very old. I probably had this particular slide in a lecture as long ago as 10 or 12 years ago. When I, at that time, did just think it was sort of funny. But nowadays, I think if you replace some of those words on the dials with words like vaccinations and autism and COVID and quarantine, you'll see that these sorts of, the questions about the kinds of conclusions we can believe in become critically important questions. And in addition to the critically important questions, these are questions that are not just scientific questions. They are questions that bear on how we choose to conduct our lives, what we eat, where we send our kids to school, the kinds of medicines and interventions that we're willing to accept in the healthcare setting, the kind of exercise we do or don't do, many, many things that have important ramifications in our day-to-day lives. And I'm sure you are all familiar with this term, this expression, new study finds whatever. At the end of almost every news broadcast, there's a segment that talks about a new medical finding. These are just a few that I pasted in about, a smartphone app could be used to intervene in depression. The very contentious claim right now that e-cigarettes can help smokers quit. I don't know if any of you are familiar with this body of literature, but it's interesting because it's a new body of literature because e-cigarettes are new, and lots of claims are being made. Claims initially that e-cigarettes did help smokers quit, new claims that they do more harm than good in existing smokers, and newer claims that none of those are true, and in fact what's really happening is they're just hooking young people on nicotine in a different way. The medical literature on hormone replacement therapy for menopausal women has been interesting to watch over the years because hormone replacement therapy at one time in this country was the most prescribed medical intervention because every woman past menopausal age, essentially every woman took it. And then there was a big reversal of that phenomenon based on data that came out of a large observational study. And now again, there's something of a reversal. There are different kinds of hormones. So these questions are important questions. And in fact, many of them are silly, right? So it's very easy to find silly conclusions being made about medical evidence and what looks like silly studies happening. I'm interested in gamification, which is this idea that if you turn exercise into a game, it will get people to exercise. These are interesting questions. When we become critical consumers of research literature, it equips us with some skills to think about if and how we want to implement some of these kinds of conclusions, some of these therapies, practices, whatever they are, in our own lives. And we want to become individuals who are capable of using evidence, right? So that's what we're really talking about, is the incorporation of an evidence base into our decision making. The problem is that not all evidence is created equal, and that is true. Published, peer-reviewed literature is not all equally good. So the framework that we're going to use is shown in these bullets. Evaluate the journal or the source of the material. Evaluate the type of research it is, the type of article. Evaluate the study design. Evaluate the statistical conclusions, and then evaluate the conclusions. So let's talk a little bit about evaluating the source for these kinds of scientific claims. So it used to be the case that one could generally trust research journals. When I was coming up in graduate school, nobody ever said, don't trust this journal or think about the source of the material. It was kind of accepted that if something got into a peer-reviewed journal, it was probably somewhat legit. That is absolutely not the case anymore. This whole field of meta-research has arisen that's about thinking about how good the peer-reviewed literature is. So the first thing that you can do, and it's easy to do and you should do it every time, is to evaluate the journal impact factor. So you're reading an article, it's published in a peer-reviewed journal, you've never heard of the journal before. The proliferation of journals has been amazing over the past years. And so one really quick and easy way that you can take a look at the goodness or quality of the journal is to evaluate its impact factor. And so all you would do is go to Google, put in the name of the journal in double quotes, and then the expression impact factor, and see what you get. An impact factor is a calculation that's done that reflects the average number of times a paper published in that journal is cited in other journals in the 2 years following its publication. So let's think about what that means. If a journal publishes a paper, the idea is if it's a good journal and it's well read, other people will read that paper and then they will cite that paper in their own research. So this is how the journal impact factor works as a measure of journal quality. But you can also imagine that a pretty low number might be fine. What if the number is 1? Well, if a paper published in a journal gets cited once in the subsequent 2 years, that's not awful, right? It's better than less than once. And in fact, sometimes you will see journal impact factors that are less than 1, reflecting that on average, papers published in that journal don't tend to get cited in the subsequent 2 years. I'm sorry, that shouldn't say preceding, that should say subsequent. And that's not an awful thing. So journals with impact factors between 1 and 2 or 1 and 3 are generally considered, they're fine. 1.5, 1.8, 2, 2.5, 3, 3.5, those are good. The best journals, the really heavy hitters like JAMA, the New England Journal, they have impact factors around 30. So it's never going to get higher than that. And this is one of the reasons why it's difficult to use journal impact factor as an absolute, because only the heavy hitters have those kinds of impact factors. Other reasonable middle-of-the-road journals can have impact factors around 1, as I said. So you would want to look and see if it's around 1 or more than 1. That's a fine quality journal. The issue with this is about the issue of indexing. So for a journal to have an impact factor, it must be indexed. And indexed means that the contents of that journal, articles published in that journal, are indexed through a legitimate and reputable search engine, usually Medline or Scopus. If a journal is not indexed, then you can conclude that it probably isn't a great journal if the major search engines the scientific literature search engines have chosen to not pick up that journal and index it in their search results, then that's a suggestion that that might not be a great journal. And that journal wouldn't have an impact factor because, it might, I guess. So let's just skip that, right? That journal could publish a paper, and then papers could get cited subsequently in journals which are indexed, and therefore that unindexed journal would still have an impact factor. And as I said, it's easy to just Google these. There is an actual report called the Journal Citation Report, which you can access through Scott Library website. But it is easier, I think, just to Google it. So let's talk about open access a little bit. Open access is a model for scientific publishing where the articles published in the journal itself, in fact, is freely available to everyone. So this was another big issue that has just started to be resolved in the last 4 or 5 years, which is that only people who could log into libraries, academic libraries in general, could get access to medical research. And so there was a part of this sort of open science movement that you guys have heard me talk about before, this idea that so much important medical literature is published or is government funded, right? We, the taxpayers, are paying for the NIH, which is giving out these big grants to do these important studies, and those important studies are only getting published in places where the average person can't access them. And so open access was supposed to be a way to address that problem. And so open access just means everything is right available online, and you can go to it and read it. There are some really, really good open access journals. So the one I've put down here, that is the PLOS journal, Medicine, has an impact factor of 14, or it did when I put this slide deck together. It might be higher now. So there are very, very good open access journals. Just an FYI, if you're interested in knowing, the business model for open access is that the author has to pay for the article to be published. Because this isn't a journal that is collecting a bunch of subscription fees, which was the old model. And so this was a very big surprise to those of us who publish a lot, that in the old days you'd send your manuscript off and they would, accept it and they would publish it, and all of the fees associated with publishing were borne by the journal, and the journal made their money by selling subscriptions to libraries. So now that it's open access and they don't have library subscription fees, they have to make their money some way. And the way they make that is that the author pays. And these are not cheap. They're generally somewhere between $1,500 and $2,500 to publish. So it's a great model. We're still working out how we're going to work on the funding. At Jefferson, there is an open access fund that authors can apply to try to get an open access fee paid should their article get accepted in an open access journal. And as I said, there are very good open access journals. Again, if you wanted to figure out if an open access journal was a good one, there is this omics that you can appeal to, which is a search engine to figure out the exact thing that we're talking about, which is sort of the quality of the open access journal. But again, you could and should just Google the impact factor. But I will tell you that what also happened as a result of scientists getting socialized to the idea that they might have to pay for their own articles to be published was, opportunity to make money. And so all of these open access journals sprang up out of nowhere and tried to jump in and take advantage of the idea that you had a group of scientists, all scientists now, right? Not just in the US, but worldwide, who had been socialized to the idea that they might have to pay $2,000 to get an article published. And so a bunch of predatory open access journals came around. I get routinely, and you can see this is from a couple of years ago, but I still get at least 10 emails a week. Yeah, at least 10 emails a week saying, "Oh, dear Dr. Lanoux, we saw your most recent publication, and we'd love it if you would consider publishing with us." So it's interesting because how do you know if this is a legitimate journal? Well, I'll tell you, first of all, in 99.9% of the cases, no journals are going to come after you and ask you to publish something, right? So the model where the author still works very hard to put a manuscript together, picks out the journal they want to submit it to, begs the journal, basically, right? Goes through all of these rounds of peer review. Hope if you're lucky, you get through peer review. And so I'll tell you, right, if you're receiving solicitations for submissions, it is probably predatory. These predatory journals are difficult to distinguish, though, from non-predatory journals, because if a journal, an open access journal, opens up shop and accepts articles and then accepts money to publish them, what makes them any different from the best open access journals like PLOS Medicine? The difference is in peer review. In the beginning, these predatory open access journals did not have peer review. They would just take your article and then they would hold on to it. They would say they're sending it out for peer review, and then they would publish it, and you would pay your $2,000. And many, many people in the early days of open access publishing fell prey to that model. And so as a result of many people falling prey to that model, in 2000, I don't know, maybe 12, there came about this platform online called Bell's List. Even though it looks like it's pronounced Beal, it's Jeff Bell, and he took it upon himself, he's a library scientist, to put together this list of predatory open access journals. And it was called Bell's List, and it was a wonderful resource because, it was in the beginning difficult to figure out what was predatory and what wasn't predatory. And let's be honest, not everyone, even successful scientists with grants, not everyone is going to be able to get a paper into one of the heavy hitters, right? And so there was, I think, in the beginning, a desire to maybe take advantage of some of these new open access journals that had come around. But we needed a way to figure out if they were predatory or not. And so Jeff Bell, he put together this Bell's List, and it was great. And for a really long time, this is what I recommended. You got to go to Bell's List. But then they shut Bell's List down. So interestingly enough, right, this was just in 2017, Jeff Bell was forced to take down the site, and it was on the basis of, I don't know how to characterize it, maybe not a lawsuit, but a complaint that was brought against him by a group of journals. Many of these predatory open access journals are owned by the same company, so there's, a handful, maybe a dozen of these publishers, and each publisher has several or many open access journals in their portfolio. And so what they said is, who are you to say that we're predatory? Right? I'm accepting manuscripts, I'm reviewing them, and I'm publishing them. You have no right to say that I'm predatory. And I think it was the case, and I think it is the case, that some of those journals did sort of go legitimate at that time, right? They did start to make more of an effort to solicit actual peer review and do a better job of ensuring the quality of published research. But because the list by that time had become so relied upon by people like me, they created a Weebly backup of it. So you can still access the Weebly backup at the site that's on the slide. That was current as of 2017, which is pretty comprehensive. Although, again, I will reiterate that there are new predatory journals coming online all the time. And so it does pay to be careful. In terms of thinking about publishing your own research, right? This is where you really, really need to be careful and not get taken in. I do know personally some folks who've been taken in by these predatory journals. And these are sophisticated, normal people, colleagues of mine, who just, didn't have the savvy to figure out that they should be careful. Because you can see what's written on this slide is that we hope that tenure and promotion committees can decide for themselves how importantly or not to rate articles published in these journals in terms of thinking about, the achievements of a particular academic. But in terms of finding articles to use and cite in your own research and in your own proposal, you should just absolutely not use or cite any journal that doesn't have an impact factor over about 1. And that will probably filter out the vast majority of predatory journals or articles published in predatory journals that you might come across. I did just want to drop this slide in here because it's very interesting. So around that same time that predatory journals started to become a thing, predatory conferences also started to become a thing. So, a scientific conference is where a group of people who work in a specific domain get together, right? And there are podium presentations, people give talks, they have posters. What they're doing is disseminating their research. And the way a conference works is you submit, a very short abstract generally. So it's not as comprehensive as submitting a paper for review. It's a few paragraphs. It's less than a page. And the conference organizers say, yes, your work is good. It's interesting. Come and present it at our conference. The vast majority of conferences accept almost all submissions because conferences are to make money, right? That's why organizations host conferences, because they're money makers. And so there's a small difference between publishing something in a predatory journal that doesn't have any peer review, which is clearly bad, but there's less of a difference if going to a conference that's organized by the American Psychiatric Association or Academy Health versus going to a conference that's organized by a shady organization. Because if you get a group of scientists together in a convention center and they're all talking to each other and looking at each other's posters and talking about the research, that's almost exactly the same thing as happens in a quote unquote legitimate conference. So really interesting, right? There's this whole thing is brewing and it's all pretty new. So I'm personally interested in seeing what happens over the next few years and how they work to sort those things out. Another issue that's about evaluating the source of an article or a conclusion that you want to use or cite is to look very carefully at the acknowledgments section. Whether or not an author with a conflict of interest or a study that has a conflict of interest because it was funded by, let's say, a pharmaceutical company, there are very, very strict requirements for disclosure of conflicts of interest. So when you go to submit a paper, you are absolutely asked to attest that you had or did not have conflicts, and if you do have conflicts, you have to say exactly what they are. Like you can see here, it says Dr. Giovanni has received consultancy fees, honoraria, and grants from Biogen. But you can still publish the paper. So the discretion is at the reader, the consumer of that information, to decide if those kinds of conflicts are significant enough to potentially impact the results that you're reading. And that's a philosophic question. I would say, and maybe I have said this to you guys before, all authors have a conflict of interest, right? It's your research. Maybe you got a grant. You want to get that paper published. I mean, you have an inherent conflict of interest. You are so deeply invested in the results turning out like you want them to and getting them published. And so just, something to think about. I think journals are better at this than they used to be. And this arose largely from some significant conflicts of interest that arose when tobacco companies, for example, were funding studies on the cancer-causing potential of cigarettes, when the Milk Advisory Board in the United States was funding all kinds of studies about how healthy milk was for kids. So some conflicts of interest appear glaring and obvious, others not so much. And I just encourage you to think about another sort of data point to think about when you're thinking about the quality of published research. And just before we leave this topic, I'll say this is why federally funded, i.e. the NIH, PCORI, federally funded research is considered the best research because it is the least likely to suffer from conflicts of interest. However, a great deal of research is funded by payers, pharmaceutical companies, and it doesn't make that research necessarily suspect. However, it's just something for you to keep your eye on. Okay, so now we're going to talk about evaluating the kind of article that you find. So we looked at the evidence pyramid. This is just a different way of thinking about the evidence pyramid. And I like to show it this way to make the point that the vast majority of research that you read is an original piece of research, right? Someone saying to you, here's my study that I did. I had just one group of people, or two groups of people, whatever it was. I did one specific study, and here it is. That is called original research, and it is an evidence generation exercise, right? People do research. Why are they publishing all these papers? Why are there so many papers being published all the time? It's because they're generating evidence. We're going to talk about how you then use that evidence. But as you know, there has been a push in recent years toward more reviews, more systematic reviews with meta-analyses, which we'll talk about in a sec. And those are exercises in evidence synthesis. So we're just making the distinction between evidence generation and evidence synthesis. And roughly the confidence that you can have in the conclusions that you find in those kinds of studies. So it's like the evidence pyramid upside down. So I like to ask people about why is there so much evidence. If we know reviews are better, evidence synthesis is better, right? Someone takes all of the evidence in an area and they synthesize it. That is a better, more trustworthy way of finding an answer to a scientific question. The original evidence, the single studies, they're points of evidence. And so what I'm going to talk you through is this idea that how do you use those points of evidence when you are reading the literature? So, we tell students, do a literature review, or your document has to be cited. Your significance section has to have citations in it. And you go and you look and you see there's like 1,000 possible articles that you might cite, right? And I think even more than the total number of articles that might seem overwhelming, the question is, what am I supposed to do with those? What is a literature review? Are you just supposed to review everything that's ever been written on the topic? No, that's not doable. So we talked a little bit about this idea. We talked really briefly about the idea that when you write a significance section, it's supposed to be like a funnel, right? Where you go from the most general down to the more specific. This is a different and much more focused way of doing that, right? So we're going to talk about using evidence that you find in the literature once you've evaluated the journal that it came from and you feel confident that it's a high quality piece of evidence. Now the question is, what are you going to do with it? And you're going to use it in a formal argument structure. So the answer to that question is that the evidence that you find, each specific article or study that you find, serves as a premise in a formal argument structure. So this is a little bit from philosophy and philosophy of science about argument structures. So in general, there's two kinds of argument structures, inductive and deductive arguments. Induction is where you go from particulars, specific things, observations, to generalizations. So this is actually the kind of reasoning that we all do. This is, in fact, the kind of reasoning that's sort of built into our nervous systems, right? You pick up all of these individual points of evidence around you, like every time I go out in the sun, I come home and I don't feel very good, right? And if that happens to you 10 times, you come to a probabilistic conclusion about the effect of sunburn on you. And so you see that on the left-hand side there, where it says if P, where P stands for premise, if premise 1, if premise 2, if premise 3, right? You list out a big list of premises, and then you use those premises to arrive at a probabilistic conclusion. That's inductive reasoning. Deductive reasoning is something different that we're not going to spend a lot of time on, even though it's super interesting just to note that both induction and deduction are parts of the wheel of science. But what actually happens in the vast majority of scientific reasoning ends up being this probabilistic inductive reasoning. And so, if you look at an empirical article, and by empirical I say, I mean data-driven, right? An article that's presenting data, i.e. an original piece of research, they're all laid out the same way. They're laid out with an introduction. The introduction generally ends with some sort of a hypothesis or an aim. They have a method section, a results section, a conclusion, well, a discussion section that includes some conclusion. And the reason they're generally structured the same way is that the introduction section, or in your guys' case, your significance in it section, is supposed to set up an inductive argument. So, an inductive argument, as we said, is this very simplistic, probabilistic form of reasoning. This is a silly example. But it's not so silly if you substitute the word bird for swan. I see a black swan, I see another black swan, and you see another black swan. It's a reasonable, inductive, probabilistic conclusion to conclude that all swans are black. But that's not true, right? All swans are white. You might be at a lake where there was an oil spill. You come to a reasonable, probabilistic conclusion that all swans are black. You would be completely wrong. Inductive argumentation is, in fact, very much subject to coming to bad conclusions. And the thing we're not going to talk about is the whole philosophy of science tradition from Karl Popper, who was the one to say, this doesn't work because it doesn't allow for disconfirmatory evidence, right? But we're not going to talk about that. We're just going to stick with inductive argumentation, because most introductions, when you read an introduction section in an article, the introduction section is an inductive argument. And once you know this is true and start looking for it, then it's very easy to find. Why are they citing the studies that they cited in their introduction section? They're setting up an inductive argument, right? So they're saying, oh, here's a study that found what I propose. Here's another study that found what I propose. Here's another study that didn't find what I proposed, but here's the reason they didn't, and therefore I hypothesize whatever, right? This is how introduction sections for empirical articles are set up. And so, let's go just to the next slide and we'll talk about that. So here's a more structured, organized version of what we were just talking about. Introduction sections, including your significance section, and in general, you might want to pick up this guidance and use it moving forward if you're writing any actual scientific articles. They're all pretty much structured in the same way, right? They have an introduction section, or an introduction paragraph, which is some general context, how big the problem is, a statement of theory, which we'll talk about in a subsequent lecture, right? That all sort of, sets the stage, some pretty generic introduction paragraph. And then the rest of the paragraphs are annotations, they're premises. where the premise is operationalized as an annotation of the article. And I'm going to show you an annotation in a second. But essentially, right, an annotation is just a short summary of the whole article that you read that ends with its conclusion, the conclusion of the article that you read. And so, you know, there's Article 1 with its conclusion, Article 2 with its conclusion, Article 3 with its conclusion, down to the last one, however many you're going to cite. And then some concluding statement that says, on the basis of the evidence reviewed here, I hypothesize, or we hypothesized. This is a very typical inductive argument structure, and you may also recognize it as the pretty typical 5-paragraph structure that you might have learned in high school writing, right? So that's why the 5-paragraph structure is laid out the way it is. Most scientific writing is organized this way. This is how you should think about organizing your significance section, right? As like a funnel, starting from the broad, which is your introduction paragraph with your problem statement, and then down to the narrow. And the very narrow is literally the statement, on the basis of this evidence, right? We propose the following. We hypothesize the following. Okay, so I want to show you an example of how that works in a real article. So this is an article that came out in JAMA Internal Medicine a few years ago, quite a few years ago now, but I like this example mostly because I was excited about this research when it came out, because it's about resveratrol, which is a compound found in the skin of red grapes, so also in red wine and chocolate, things I love. And there was some enthusiasm and excitement initially that resveratrol might have a positive impact on mortality. So this is a study about resveratrol levels and all-cause mortality in older community-dwelling adults. And let's take a look at their introduction section. So I pulled their paragraphs right out of the article, and then next to them I summarized what they were trying to say in terms of the premise. So you can read what's sort of over on the left on your own, and then you can trust me that my premise summaries are good. But basically they started with a general statement, what it is. It's this polyphenol that's found in these places. And then they say resveratrol has anti-inflammatory properties. They go on to say resveratrol increases lifespan in animals. Then they say resveratrol has demonstrated some anti-inflammatory effects in people, and they give some evidence for that. Then they do this other sort of song and dance where they say, but it was only, a phase 2 trial. Maybe, there's some conflicting evidence nonetheless. And then the final paragraph, they say there's little epidemiologic data to support a link between resveratrol in the diet and health in humans. So if we stack these premises up, resveratrol has anti-inflammatory properties in vitro. It increases lifespan in animals. It's shown to have anti-inflammatory effects in humans, and there's little epidemiologic data, and epidemiologic data means large-scale person-level data. Therefore, right, if we stack those premises up and ask ourselves, what conclusion do these premises lead you to? What conclusion would you come to, or do you think these authors are trying to lead you to, right? They're trying to do this funnel thing where they state their premises and it funnels you down to their specific aim or their hypothesis. So I'm sure you're not surprised that what they say is, we hypothesize that higher urinary concentrations of resveratrol metabolites, which essentially means people who eat or drink more of this compound, right, would have lower reduced risk of mortality. And the intro section here in JAMA Internal Med, it was quite short. Nonetheless, if you get good at this, right, you can sort of start to pull out premises that people are trying to use, that lead their reader in a probabilistic fashion to their hypothesis. So I want to pause here for a minute and just say, so I said already, right, when you think about doing a lit review and you go to Scopus Search or you go to Medline or you go to Google Scholar and you type in the thing you're interested in, right, and 100 or thousands of potential papers show up. And all these years that I've been teaching technical writing, students would ask me, well, what papers do I pick, right? And then once I pick them, how do I use them? What I'm telling you is this is how you use them. I'm going to go back to this, right? You choose the citations, the highest quality citations that you can find from the highest impact non-predatory journals, and this is how you use them. You already have a hypothesis, right, or an aim. I mean, you know the area that you're working in, you picked it for a specific reason, you already have a general orientation about something. And so you can start at the bottom, right? You can start at the bottom. You start with the aim or the conclusion or the hypothesis, and then you choose the studies whose conclusions will lead your reader to the probabilistic conclusion that you already are invested in. So people then will often ask me, isn't this cheating, right? Like, you shouldn't start with the conclusion and find evidence to support it, right? You should start with the evidence and work towards the conclusion. And that is true, and that is the spirit of inductive argumentation, as we've been saying, right? You use the evidence that's available to build a probabilistic conclusion. But we are in an age of just too much evidence to do that. If you are writing a dissertation, you are expected to review every piece of evidence. But even dissertation writers go into the study often with some implicit conclusion or hypothesis, right? So I think it's fair and it's fine if you are aware of the case or the argument that you are trying to make, to then go through and choose the highest quality citations that you can that will support the implicit conclusion that you already have. And if you cannot find high quality citations whose conclusions you can use in a probabilistic inductive argument structure, then you're forced to scrap the conclusion, right? So in this way, you do use the evidence to lead to a probabilistic conclusion. You just do it iteratively. Okay, so let's get back to where we were. So there's an example of one. I'll put the article on the course site. This is comparative effectiveness of minimally invasive versus open surgical radical prostatectomy. So this was an important study when it came out. I didn't copy in all of the actual paragraphs from their introduction section, but I can show you the premises that I deduced from their introduction section. So they are saying minimally invasive, this procedure has greatly increased, especially because we can do it with robots. Patients prefer it because they think that there are fewer complications. Direct-to-consumer ads have promoted a publication bias against studies that challenge these conclusions. However, this radical open surgery remains the gold standard because there's so much additional evidence for it. And there are some barriers to implementing or adding this minimally invasive thing. And there are no RCTs comparing the two. So in the context of a comparative effectiveness study, like you guys will be writing, it is, if it's true, right, it's a very important premise that there is no comparison study. And so if that's true, you should try to support that premise. But you can see their premises here lead to, right, a pretty obvious conclusion. You can guess what they're doing, right? They're going to propose to do a comparative effectiveness study of these two things. So I put this particular one up because it is a comparative effectiveness study and because it does have a nice, reasonable argument structure that you might want to look at when you're thinking about yours. And indeed, there's the aim of their study: comparative outcomes between the two procedures. So we won't spend a lot of time on reviews, systematic reviews with meta-analysis, except to say, and I think you guys know this, that a systematic review is considered higher quality evidence than a single study. A meta-analysis is a specific kind of systematic review, and that if you are able to find them, and for consideration, you might want to cite a systematic review, then absolutely you should. That sort of inductive argument premise structure that we just walked through isn't reliant on single pieces of evidence. So you can, a systematic review is still a piece of evidence. It will still come to a conclusion. In the old days, there were a lot of review articles. They were not systematic. They were just an article that someone or a team would pull together and do a review. They were very, very popular. Systematic reviews are, in fact, a somewhat new phenomenon where the only thing that distinguishes a systematic review from a non-systematic review is that the review of the available evidence is considered exhaustive. So if you look at a systematic review, what you'll see is they published their search terms. They'll say, we searched these databases using these search terms, so that the methods for the review become open to criticism and are reproducible. That's the reason why a systematic review is better than just a review article, because presumably a systematic review is going to pick up disconfirmatory evidence, not just confirmatory evidence. A meta-analysis is something that happens along with or alongside a systematic review. So a meta-analysis is a statistical technique where you get a systematic review that, for example, answers a question about an effect. Does this treatment work? And so there is a numerical conclusion in the individual articles in the systematic review. Then you pull all those articles together, and when they have the exact same outcome, a meta-analysis takes all the statistical conclusions from the studies that are included in the systematic review and merges them. So the idea behind a meta-analysis is that it treats the results of all of the individual studies as if they were all part of the same study. It's an incredibly powerful technique. It's complex, it's complicated to do a meta-analysis. But if you can find a well-done meta-analysis and you're able to cite it, then absolutely you should. But with the same caveat that now there's criticisms of the techniques of meta-analysis, and there's like some shady shops that have opened up that are publishing crappy meta-analysis. This stuff is all very, very contentious and very complicated. But we are saying in general, a systematic review that includes a meta-analysis should be considered high-quality evidence. So I brought this up a little bit earlier in this presentation, and I'm going to revisit it quickly, which is that there is a type of research called meta-research, which was essentially invented by one person, a gentleman named John Unitas, who took it upon himself to develop a method for the assessment of research, right? So he, his whole research program is thinking about research as a whole. How are we doing? And he published a paper in 2005 called Why Most Published Research Findings Are False, which certainly something that if you have the time, you could look at it. It's quite short. So I didn't want to leave without talking about John Unitas, who was, in fact, a real pioneer. He speaks essentially mostly to medical research. And so a lot of the things that he talks about are very topical for us. And it's interesting that this slide has always been in this presentation, but John Unitas recently, very early on in the COVID pandemic, published a commentary, an essay, saying that he felt that we were overestimating the risk of COVID. And he did some quick probabilistic calculations based on that first cruise ship of folks who got sick. And then he received a lot of backlash for that. And so now, that was maybe March, and now here it is July, and he's published a follow-up to that study. And so if you're interested, you could go do a little bit of investigation and read what he does. He's just amazing. And I'll finish it out by saying that John Unitas once said that the engine of science is 15% efficient. So he meant so much research gets done, so many hundreds and thousands of papers get published, all these new journals coming, and some are predatory, and some people aren't trained well, and a lot of stuff is just out there, and it's really hard to know what should be trusted and what shouldn't be trusted. And so he said, averaged over all of that noise, that we're essentially making, 15% progress, right? So that always comforted me somehow. Okay, so we're going to move on from that, and I'm going to try to go quickly through the next few slides because we have spent a lot of time on this, right? But this is the next bullet point in terms of evaluating quality, is to think about the study design of any particular study. So we've spent a lot of time on this talking about the difference between an observation and an experiment, and what makes something a quasi-experiment, and different methods that people use to try to strengthen the quality of inferences from non-randomized studies, and then some of the ways that randomized studies can, not be as good as they should be, even though they're a randomized study. But certainly that is something to think about when you're thinking about including evidence in your inductive argument structure, is that experiments are generally considered better evidence. But it's interesting because study designs generally will evolve over time as a field matures. So very early on, for example, I'll take the ketamine example. I think I've talked about it, this term already. Ketamine is a street drug, I guess, that has recently been shown to have some evidence for potentially its effectiveness in really intractable depression. And so when a research area is very young, what you get are immature study designs, right? You get case studies, you get observational studies. And then over time, as the evidence sort of mounts, then you start to see more rigorous evaluations like experimental studies. And then, of course, the ideal would be not just a placebo-controlled randomized trial, but a comparative effectiveness trial comparing, for example, ketamine to some other treatment. So that's the way in which evidence that forms the basis of evidence-based practice in medicine and other evidence-based disciplines, how it sort of generally evolves over time. And so you wouldn't necessarily want to downgrade studies too much, right, in terms of thinking about how to use evidence to build your own argument, if something is very, very new and you're not going to be able to find an RCT, for example. So you have to keep that in mind when you're thinking about building your own arguments. We've talked about validity, right? So you can critique studies along the dimensions of internal and external validity. Okay. So I would be remiss if I didn't talk a little bit about the evaluation of statistical conclusions. So most people feel like they can't be a critical reader of statistics, right? Because they don't know, what was done, and they don't have the savvy to investigate that stuff and to be critical about it. And that may be true, and probably is true in many cases. I saw on my Twitter feed the other day an article by a guy who said, "I'm a data scientist. Do you mind if I do surgery on your heart?" Making the point that professionals, often try to analyze data, or there's an assumption that, for example, a physician would know how to analyze data, right? But physicians don't know how to analyze data. They're not classically trained statisticians, and that's fine. That's not their job. And even folks like you, learners, right, new scientists just starting out, You are smart and critical, and you may not become a statistician, but you can still gain some simple skills that allow you to evaluate statistical conclusions. And those skills fall under the umbrella of just thinking about the data that are being presented. So let's look at a couple of examples. One we're going to talk about is the notion of an effect size, and a little bit about practical or clinical significance. So the first point I'm going to make is statistics arose, what we think of as sort of the statistical models that commonly get applied in medical research studies, where you've got 100 patients, 200 patients, 300 patients. Those are inferential statistics that were developed. The whole field of inferential statistics arose and was developed to deal with small sample cases. Small sample cases could be 100, 200, 300 people. So if you're trying to come to some conclusion about the effectiveness of a drug for everybody, but you're basing it in, a sample of a couple of 100 people, then you require inferential statistics to do that. But the machinery of those inferential statistics is very subtle and complicated, right? And the machinery exists to draw conclusions on the basis of sample data. Sometimes you don't need statistics. So, for example, if some drug or therapy or treatment was introduced, which when compared to standard of care in a randomized control trial, resulted in 100 patients in the treatment group A, 100 of 100 died, and in treatment group D, nobody died, then you wouldn't need a statistical analysis to find that difference, right? And I think people forget that statistics are there for things which are on the margins. Like, they're a little better. Maybe this group on average did a little bit better. So you can always look at the numbers, right? Get to know the data, think about the data, and try to decide if it's one of those cases where there's a huge difference, or if it's one of those cases that's really just on the margins, right? And if it's really just on the margins, right, then that's worth sort of factoring into your assessment of the quality of a specific study that you are reading or thinking about using. You just have to look at the numbers. So this is an example I've been presenting for a few years. And it's a hypothetical example. And the hypothetical example concerns two drugs for schizophrenia. And the drug, the mechanism of action of the drug is such that it's supposed to have an impact on hallucinations. So I don't know if you guys know any schizophrenia patients, if you've ever interacted with any schizophrenia patients, if possibly you have an individual with schizophrenia in your family. But hallucinations are a horrible, horrible symptom that people with schizophrenia just terribly suffer with. Oftentimes the hallucinations, so the majority of hallucinations in schizophrenia are auditory hallucinations, where the individual hears someone talking in their head. And the vast majority of the content of that they hear in their heads is very negative. So it's a very negative, critical, about the person voice talking in the head all the time, right? Many, many times a day, for example. The suicide rate, the attempted suicide rate among schizophrenia patients is close to 80%, and the completion rate is close to 50%. These are people who are dramatically suffering, horrible suffering in schizophrenia. So take this example of a drug that's supposed to have some impact on hallucinations. The numbers, so let's start with drug 1 first on the left in that column that says pre. Those numbers represent number of hallucinations per day. So imagine this is a randomized a comparative effectiveness trial, right? A comparison of drug 1 to drug 2. So typical comparative effectiveness framework. If you look down the column that says pre under drug 1, you can see how many hallucinations a day these patients are having, 30, 24, 35, etc. And the average number of hallucinations per day is 29.14. And then post means after the drug, so post-treatment, the person had, went from 30 to 15, went from 24 to 8, went from 35 to 24. So the column that says diff is the difference per day. And when that number is positive, anyway, you can see the differences, right? A reduction in hallucinations per day of 15 hallucinations, 16, 11. That next line that has a -4 shows someone who had more hallucinations from 23 to 27 from pre-drug treatment to post-drug treatment. And the p-value at the bottom says p equals 0.004. So what you're looking at is an example just within drug 1 of a significant reduction in hallucinations, a statistically significant reduction in hallucinations. The mean, which is the average of the difference column, shows the average change, right? So 7.71 hallucinations per day, or an average reduction of 7.7 hallucinations per day. Now look over at drug 2. In the pre-column, you see people are having about the same number of hallucinations per day, right? 28, 21, 32. These are different people, not the same people. And you can see, again, the average number of hallucinations per day is 29, so about the same. They are treated with the drug. Here are their post-treatment number of hallucinations. So you see that column that says post under drug 2, 24, 16, 28. And then look at the differences, 4, 5, 4, 4, right? And then look at the average difference, 4.29. So that's an average reduction in number of hallucinations from pre-drug to post-drug, an average reduction of 4 hallucinations. The p-value there describes the statistical significance. So this is again an example of a statistically significant pre-post difference. So given what I said about how horrific schizophrenia is, if you were a physician in a position of making a decision between these two drugs, which drug might you prefer? Or a family member trying in a position to make a decision between these two drugs. There is no right answer to this question. It does appear that both of these drugs are effective. There are statistically significantly different number of hallucinations pre to post treatment for both drugs. The real difference here lies in the variability in how people responded. In drug 1, some people had dramatic improvements, right? Someone went from 30 to 15. That's a reduction of half. Someone went from 24 to 8. That's a reduction of 2/3. But some people had no reduction, 0. Some people had more hallucinations afterwards. In drug 2, the magnitude of the reductions is smaller, but more consistent. So in terms of thinking about using evidence for decision making, I'm just trying to make the case that you can tell a lot just by looking at the numbers and thinking about what they mean, right? Thinking about what they mean in practical terms, what they mean for you, depending on the type of decision maker you are, whether you're a patient or a patient advocate or a family member, or you are tasked with writing clinical guidelines, right? That you can take a lot of information away from nothing more than a careful inspection of just the data that's available. So in a drug study, if this is hypothetical data, but if this were not published, if this were published somewhere, you wouldn't see the actual numbers, right? But you would see the means and standard deviations. And from just the means and standard deviations in this study, you could certainly intuit what's going on, right? A mean reduction of almost 8, but with a standard deviation of almost 8. That's a large average reduction, but with a lot of variability, versus a mean average reduction of only 4, but with a standard deviation of less than 2. So less reduction, but less variability. just look at the numbers. I'm making a big deal out of this because several years ago I was helping a resident with her journal club, and she was reviewing a journal, an article. It was from a good journal. It might even have been JAMA Internal Medicine, and she was puzzling over the descriptive statistics like this, just looking at the numbers and percentages that were reported in the tables, digging in, and we found a mistake. And we ran it forward, we ran it backward, we made sure we knew that we were thinking about it the right way. Oh no, it was a mistake. And so we wrote a little letter to the editor at that journal and said, there's a numerical mistake in table 3. And they had printed a little addendum to the study. People make mistakes all the time. And so that my whole sort of point that I'm making with this is you don't have to be a statistician to look carefully and think about what the numbers mean. Okay, so here's another example of that, which actually was a pretty contentious thing that happened not that long ago, which was that this study got published in Preventive Medicine, which is a big deal, very, very, high caliber journal. And the study was entitled, Attractive Names Sustain Increased Vegetable Intake in Schools. So you can imagine what this study was about, right? They named the carrots that were served to the kids, either X-ray vision carrots, food of the day, or unnamed. And then they looked to see how the naming might impact the number of carrots that the kids ate. So this is actually an interesting question. How can you get kids to eat more vegetables? And I'm not going to walk you through these numbers, but if you wanted to, you could see that there are some pretty glaring numerical problems in this study. And it was someone, a blogger, Hacker Noon, if you wanted to look, hackernoon.com, found this problem and posted it on his blog. And there was quite a bit of debate among us biostatisticians about, as soon as you find a numerical mistake, right, you have to start wondering about the quality of and believability of the rest of the study. And then sure enough, not that long after, they retracted the article. And so the takeaway I want you to get is you don't have to be a statistician, but you are smart and you are a critical thinker, and you can really learn a lot by just paying close attention. Okay, so we're almost done. One thing that John Ioannidis talks about is the fact that there is too much statistical significance. Every study shows a statistically significant effect. So on the whole, what can be made of that? Does that impact the extent to which you trust that evidence or not? And I will just say, I think keeping to the very high quality, high caliber journals is probably your best bet for thinking about, picking evidence that's high quality evidence, right? Okay. So that's it. So I'm going to post another lecture for you guys, and I will see you in just over a week. I hope you're all doing great.